At the end of the lecture, the students or the participants must be able to understand the key concepts and principles of behavior change modules and their theories. You should be able to also identify and differentiate between the various behavior change modules and the theories, and analyze the strength and limitations of different behavior change modules and theories, and at last to demonstrate the ability to select and apply appropriate behavior change modules theories to address specific health behavior challenges. So just to dive into the gist of the matter, it is very important that we understand what a theory is. And in this regard, a theory is a set of interrelated concepts, definitions, and propositions that present a systematic view of events or situations by specifying relations among variables in order to explain or predict the event or situation. For example, the social cognitive theory is a theory that explains how individuals learn from observing others and how self-efficacy influences their health behavior. So, in other words, a theory is a set of phenomenon, meaning that there are particular uh, uh, sets of rules that if this happens, then this will be the outcome. Or, for example, if you looked at the Malthusian theory, it looks at the possibility that if the population exceeds, if the population then exceeds the food production, then there is going to be a population trap. Likewise, in the social cognitive theory, it has an explanation that an individual's environment then determines how they behave. For example, for a young person who is living in a society where they are observing people not going to health facilities and people using herbal medicine, then the retrospective action or behavior would be that that particular individual will practice the same, will not go for antenatal care services at a health facility, but will rather access herbals as he or she is observing. That takes us into another key definition called concepts. Now, concepts are abstracts or general ideas used to represent real world phenomena or objects. They provide a framework for understanding and categorizing various aspects of the world. For example, health is a concept used to describe the state of complete physical, mental, and social well being. So, when you're talking about concepts, you're virtually talking about the ability to present a certain idea. And in this particular lecture or this module, we shall be able to use different concepts that are explaining a particular idea. Concepts in theories. So the concepts is the primary element or the building block of the theory. A concept is an abstract or general notion that represents something. It is used to classify or categorize objects or phenomena based on shared properties or characteristics. Concepts help researchers communicate and organize knowledge about a particular subject. So before you come up or you theorize a particular thing, you must be able to have a concept. If you're going to do a research, then you must be able to conceptualize that these are the variables that I'm going to look at and how they influence maybe malnutrition. So if you're looking at a particular variable, then that aspect of building your theory, then it is called conceptualization. So you're trying to perceive how different factors can influence that particular aspect that you're looking at. So the definition and proposition. Definitions are precise formal statements that explain meaning of a concept. So after having a concept, for example, health, then you're able to define that particular concept. And that is what a definition is. A definition is now that formal statement that defines it. For that example, you can see there that the concept of health is defined by WHO as the state of complete physical, mental, and social well-being, and not merely the absence of disease. And then we also look at propositions. Propositions are statements or assertions about the relationships between concepts. So they express a particular belief or idea about how concepts are connected or interact. So after you have defined a particular concept, then it is about you to give a proposition, meaning you're giving your belief or you're defining an idea or your particular thinking about that particular definition. So, for example, increasing physical activity leads to a better cardiovascular health. So, what is your concept? You're perceiving or you're conceiving that if an individual has more physical activity, for example, engages more in sports, engages more in morning routine of roadworks, then the person is going to have a better cardiovascular health, meaning their breathing and their respiratory health is going to be important or is going to be better as a result of their increasing physical activity. So that is just how the proposition is. You're now giving an idea of that particular concept. So we want to define also a model, the schematic representation of reality or one's view of a possible world. So a module is trying to show how a particular uh, a particular kind of uh, let me say kind of work can lead to another planned output, meaning if someone has this kind of an input, then this will be the particular output. It is like a garbage in, garbage out in computer science. So what a module is trying to show is that it perceives a particular way of lifestyle leading to a particular uh, output. In that situation, if you're looking at a module, uh, for example, we shall be looking at the health belief model, you will be able to understand that if someone has this particular way of belief, then this will be the output. So that is what a module shows. It shows a constructed style of output or view of lifestyle. Constructs in theories. A construct is a specific abstract and a theoretical concept developed within a particular theoretical framework. Constructs are created to describe a complex phenomena that are not directly observable but can be inferred from observable variables or behaviors. Constructs are often driven from multiple concepts and explain the relationship between variables in a theoretical framework. Operational definitions translating abstract constructs into measurable indicator or variables. So a construct is largely trying to explain, uh, for example, if we wanted to look at, if we said physical activeness then leads to physical to improved cardiovascular sense, then you're looking at if it is a construct, then for you you're looking at What is the relationship between having a higher physical output or being physically active and your cardiovascular health? So the aspect of trying to look at that relationship, how does it influence, is what we call a construct. So now the gist after us understanding those two, I mean those are very key concepts and what they mean, what a concept means, what a definition means, what a proposition means, what a theory means, and what a construct means. It is now very key that we come in and understand the practicability of these concepts or these theories. So we need to understand how theories apply in health promotion. So theories help to develop an organized, systematic, and efficient approach in investigating health behaviors in order to inform the design of theory-based intervention programs. So what happens is that because you're theory focused, you do not just have a health promotion intervention without any guidance. So why do people behave as they do? Why are they not behaving in healthy ways? What information do people need? What constructs to apply? What is the justification for the program? So to design this approach, you need a theory. For you to design an intervention for a particular health promotion, you must be asking these questions. And these questions can be guided for you to develop a particular theory. However, there are already theories that explain human behavior or the particular behavior in which people seek care, which we just need to go ahead and understand in this module. So the levels of theories and modules, we look at the interpersonal level of theories. One, these are individual characteristics that influence behavior. For example, we are looking at people's knowledge. What is an individual's knowledge about a certain style of lifestyle? What are their beliefs? What are their attitudes? And what are their personality traits? Now, their personality traits, you're looking at what someone likes, what someone does not. Two is the interpersonal. These are processes and primary groups. Now, we are looking at someone's family, we are looking at someone's friend, and we are looking at someone's peers. These now provide someone's social identity. For example, an individual whose peers practice homosexuality or identify themselves as a homosexuality, there are higher chances that that particular person will also be associating to that same kind of thought. Same like individuals who would be practicing heterosexuality, who are heterosexuals, there are chances that their behaviors will be heterosexual. So these are interpersonal uh, interventions, or these are interpersonal influences that occur. The third one is organizational. We're looking at rules, regulations, policy. We're looking at informal structures which may constrain or promote a certain behavior. So, in this regard, we may look at a nation. There are nations that have constitutions that guide how people or how their civic population should behave, and they are the ones that have a higher chance in influencing people's behavior therein. Uh, we look at the community as a large, and as we discuss the levels of influence and theories, you need to understand how these particular modules may influence an individual. There are some of them that may influence an individual at a higher level. For example, for students in a particular school, the laws or the school rules and regulations to a larger extent may be influence their level of behavior. But also in communities that are very traditional, their traditional laws and cultural beliefs may influence the individuals in a very higher level. But also there are influences that are religious. So for a community that subscribes maybe to a Catholic belief of faith, there are chances that you may not be able to go there and preach information on, on modern contraceptives. You may not design a health promotion on modern contraceptive for a community that is predominantly Catholic because of the constraints in which they work. Likewise, you may not also go and preach uh, issues of monogamy in a predominantly Islamic community. So it is very important you understand these dynamics. So another issue here is the public policy. These are all levels of influence. So local, state, and federal policies regulate or support healthy behavior. So if public policy states that there is no public smoking, then the chances that it may be a healthy, it may support healthy behavior are higher, and then you can draft your health promotion information in that regard. So there are theories and models of health behavior, and for this particular session, I am only going to look at because we are time bound. I'm only going to look at possibly three of them, and we shall look at the others in our next session, which I suggest could probably be tomorrow. And these are the theories we have, 6 of them. These are very important theories. If you grasp them, then it will be very easy for you to design your community intervention in that community. After you have your demographic data on this particular community, then the health belief module, the theory of planned behavior, the trans-theoretical module, and the social cognitive theory, the diffusion of innovation theory, and ecological model will be very important for you. For those who do research, most times you are advised to use a particular theory in making your dissertation. And these are some of the theories you can use to make your conceptual framework. So it is very important that you understand them here. So first we want to look at the health belief module. This is a social psychological module that attempts to explain and predict health behavior. It proposes an individual's beliefs about their susceptibility to a particular health problem, the severity of that problem, the benefits of taking prevention action, and barriers to taking preventive measures, or hesitance to make a decision to engage in a health behavior. So the health belief module is psychological one, meaning it depends more on an individual, and whereas there are different variables that may influence it. Let me just create a slide here so that you can be able to view that photo very well. Let me just copy it and paste it here. Okay, good. So this is just an illustration of the health belief module here. So what happens is that if like I earlier said, when you're applying such a theory, such a psychological theory, you should be able to understand the demographics of your population. So your demographic variables would look at what is the social class of this person, what is the gender of this person, what is the age of this person, For example, is he a young person? Is he an elderly person? Is he female? Is he male? Is the community predominantly male? Is the community predominantly female? But what are their psychological characteristics? What are their peer groups? Are they predominantly male young peer groups? Are they out of school? Are they
Yes,
out
sir.
of school peer groups? So from this particular demographic variable or the individual's characteristic, then you will be able to determine one. For example, it was stating for you that it proposes an individual's belief about their susceptibility to a particular health problem. So the first aspect would look at the person's perceived susceptibility. They believe that I am at risk of developing a health condition. For example, that a young girl or a newly married couple starting to believe that she is at risk of, uh, of getting pregnant. Now, for example, if you wanted to determine uh, the, 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 the possibility of people attending antenatal care, what is the behavior of the community on attending antenatal care? So in this health belief module, the first aspect would be what is the perceived susceptibility? What is the belief of an individual that they are pregnant? So if someone does not perceive that they are at risk, for example, I do not believe that I am at risk of getting COVID. If that is what is the perceived susceptibility. So, for example, this health belief module can help you assess even the fact that individuals were not taking the COVID-19 jab in very many communities. So, the perceived susceptibility was that they are not at risk of developing a condition. Two is the perceived severity. They believe that the consequence of a health condition, they believe that even if I got this COVID-19, how severe will it be? Can it even kill me? It cannot kill me. So then that is the person's perceived severity. So the number two is that what is the individual's perceived benefit? That if I took this action, they believe that adopting a specific behavior will effectively reduce the risk of developing a health condition or experiencing a negative health outcome. So they believe that if I took this jab, it will reduce my chances of getting infected or getting a more severe infection. And then the fourth one is the perceived barrier, the perceived obstacle or the challenges that hinder an individual from adopting a healthy behavior. Say maybe my culture does not allow me to do vaccination, or say uh, my religion does not allow us to take vaccination because they believe God is supreme. So these are some of the perceived barriers that would go into that individual's mind. And then the fifth one is the cues to action. What are the events or the information that motivate individuals? Could it be that he feels if now that he has children, if he got infected, he may infect his children, or there are certain events that the one of the relatives has acquired this disease and has possibly died, unfortunately. So these are the issues that may trigger someone to go and take that jab. Then the sixth one is self-efficacy. They believe in one's ability to perform a specific behavior successfully. So the individuals believe that I can actually take this jab is the last construct of the health belief module. We can even have an experience of why people were not using the face masks. The health belief module can help you assess that very well. Do they believe that they are at risk of getting infected? What is the consequence? So it is an interesting module. I think that example that I have just given you on COVID can help you understand it further. And so, what are the advantages of this module? The health belief module, abbreviated as HBM, has been used extensively in research and has been found to be a useful tool in predicting and understanding health behavior. Just like I have used it to uh, to just predict possible behavior towards the COVID-19 vaccination. It may even apply to antenatal care. It may apply to eating certain foods. It may apply to uh, vaccination of young children, child health. It may apply to maternal health, how mothers do institutional delivery or not. It may apply to certain aspects of public health, why there might be polio, measles still in our societies. So it gives an explanation and prediction of very many health behaviors. It is also a relatively simple tool, making it easy to understand and apply in various settings. Then the criticism of the health belief module. The health belief module does not consider social and environmental factors that may influence health behavior. Whereas we are looking at an individual themselves, it is less that the health belief model looks at the possibility that someone staying in a colder environment uh, may be influenced to make a certain health belief. So the health belief model does not take into account those environmental factors. It also assumes that individuals are rational decision makers and may not account for emotions or other non-rational factors that may influence behavior. So in this regard, it is looking at that person being very radical. Just says, for me, I'm not taking this jab. That is all. May not even have a reason. May not even be non-rational. For it does not. The health belief model does not tell you the factors that may influence that behavior. So for it believes that the individual is very radical and autocratic in that regard. What is the application of health belief module? This module can be applied in very many health behaviors. For example, cancer screening, immunizations, as I told you, smoking cessations. So, whereas the issues of smoking may be as a result of addiction, it also applies here. So, the person looks at how severe, what if I smoked, how severe, what is the severity? So, what is the person's perception of smoking? So, it gives a variety of trying to explain health behaviors. The second theory is the theory of planned behavior. It is also a social psychological model that proposes that an individual's attitudes, subjective norms, and perceived behavioral control influence their intention to engage in a particular behavior, which then influences their actual behavior. So here it is looking at someone's attitude, someone's norms, and someone's perceived thoughts, and then it will push this person to intentions. But you realize that someone's perceived behavior control, how an individual wants to behave, can straight out susceptibility, the perceived severity, the perceived benefits, and the perceived barriers, how they influence someone's action, how the influence someone's cue to action, then the action itself. So this is how it flows, as I just explained, from the perceived susceptibility to perceived severity to perceived benefits to perceived barriers. Away from not being able to see the slide earlier, uh, I'm quite sure you were able to get the explanation. So these are just the slides. Let me just show them to you here, and the advantages are as well here, which I elaborated earlier. Then the criticism, as I explained, and I think this is how you can apply that particular theory. So let me just re-explain this theory of planned behavior. As I said, you can be able to see this particular figure showing you how an individual's attitudes, their particular subjective norms, and their perceived behavioral control influence their behavior, their actual behavior. And I said that the perceived behavior control, if you were to see this arrow, for it influences directly the behavior, but also it influences the intentions of the individual. However, the person's attitude and their particular subjective norm first influence the person's intention, then later influence the behavior. So the attitude toward the behavior, the individual's positive or negative evaluation of performing a specific behavior. So what is the person's attitude towards delivering in a health facility? What is the person's behavior towards having a specific balanced diet? What is the person's behavior towards attending 4 antenatal care visits? That is now attitude that is being explained in the planned behavior. Now, the second issue of the subjective norm, the perceived social pressure to perform or not perform a behavior based on the beliefs of significance. So, what does the society believe? How does the person's family, the person's friends, and the person's peers, what is their perception about antenatal care? What is the pressure or what is the level of influence they have on this person to go and attend antenatal care, the 4 visits? But also, what is the person? What is their perception on the person to go and have their delivery at the health facility? But also away from health, it can be looking at what is the peers' perception on saving income, saving money. There are societies that do not believe in the banking system. So these are all pressures that are what we call subjective. They are not coming within, they are without that person, they are outside that person, they are in that person's social life. So they are subjective. They influence the person in a passive manner. The third aspect is the perceived behavioral control. They believe in that person, in their ability to perform a behavior, taking into account factors that may facilitate or impede the behavior. So, what is the person's behavioral control would be looking at what is my ability to go to the health facility? Do I have the transport to go to the health facility? Uh, can I go for the 4 visits? So, uh, can I go there timely? So it is about the person's ability to be able to perform that task. So you may realize that the person says, going for antenatal is a waste of time. Those are the different aspects that may influence that particular person's behavior towards a specific uh, uh, health problem. So now, up to that far, can you be able to see that? Were you able to see where I've ended? Okay. So, Samuel, I think our time is fast spent. I would request that for the theory of reasoned action and social cognitive theory, we can fix time tomorrow. I don't know what is the most